And so on your patient, all you're gonna see is just a bump. Maybe if they're skinny, you'll see a catheter. So to assess the patient, I would put on my gloves. You're going to use a triangulation of your fingers to spread the skin tautly, and then you're gonna feel for that self-sealing septum right there in the middle of that catheter. I'm gonna feel the rim around, and again, just triangulate your fingers and feel for that self-sealing septum. In my mind's eye, I want to do an insertion right down into the middle of that self-sealing septum. If you have to push it forward, backwards, side to side, however you need to stabilize that Portacath, then you do that, and then find that middle self-sealing septum, and that's what we're gonna, that's the bullseye. We're gonna try to get the middle of that. Our dressing change kit looks like this. It's the Portacath Access Tray Kit. And along with that supply, we have our non-coring Hoover needle. Our policy says to use a 3/4 inch needle first. And if you can feel it at the top of the flesh there, if you can see it and feel it, normally this is the right size. Often the patients will tell you if they need a 1 inch or a 1.5 inch. To open up our sterile Portacath tray here. Now when you open up a dressing kit, you're gonna open it up away from you and then side to side. Inside, you're gonna have a mask for your patient and a pair of sterile gloves. So that is all sterile. I'm gonna put my sterile gloves on. Now on top of your package here, you're gonna see there's some instructions and there is a fenestrated drape. However, in my opinion, I want to clean a larger portion than this. So you can use this as a sterile blanket if you want, but I don't use it for its intended purpose. I just put it on the patient like that. I always take my palm and picture my palm over that Portacath, and that is how much area I want to clean, because that's the area that the dressing is going to go over. We have 2 needles. These needles have safety caps, and then you can use it to prime your line. Now I want to take this time to clean the second part, which is chlorhexidine wand. So let's introduce you to the dressing. The dressing has 2 components to it. The 2 components are the Tegaderm piece and this part. This is 3 cg impregnated Tegaderm. You have a number 1, so you have arrows pointing up. Just peel that off and make sure that's on top. So that's on top. And then the number 2 is on the bottom, and it folds underneath the CHG impregnated Tegaderm. You'll notice there's 2 little tabs down at the end here, and those are going to be the tabs we hold and pull this number 2 out. So this is going to be our base to hold on. So you don't want any plastic coming out underneath there. You want it to be very crispy and folded right on that perforated plastic line. So what we do is we take our non-coring Huber needle. Let me undo these. And we lift up the rabbit ears like so. And we take off our safety protected needle. We take our needle and we put it right in that slit with the number 2 on the bottom, and we pull up the 2 sides to match the rabbit ears, and then we pull up the front, and then I tuck this back with my finger. So I've created a little bit of a taco package. Now we go over to our patient, and I feel for that self-sealing septum. In real life, this would be dry. And on the count of 3, I'm going to have the patient hold their breath. And the reason I have them hold their breath is because that way I will ensure blood return. So on the count of 3, I say 1, 2, 3, and then I poke down into that self-sealing septum. I take my syringe, I inject 1 to 2, and then I aspirate, and we're going to pretend that we have blood return. Now, we're going to put down the rabbit ears. We're going to hold down the little tabs. Now we have a great start to our dressing. And then we take this part of our dressing, put it underneath the catheter. My colleague likes to call it the pants. And then she calls this the belt. And this goes right on top. And so now we have a completely sterilely enclosed dressing.